Hi, I'm Lauren Jones, and I'm reviewing the article entitled Prenatal Stress and the Developing Brain Risks for Neurodevelopmental Disorders. The authors are Bey Vandenberg, Robert Danke, and Martin Menes. It was published in 2018 in the Development and Psychopathology Journal. Since I'm planning on going into OBGYN, I wanted to learn more about if stress in the prenatal period affects fetal development so that I can advise my future patients about the importance of stress relief during pregnancy. This article was generously provided by Dr. Fowler, but the paper can be found on PubMed using the terms brain imaging, ADHD, autism spectrum disorder, schizophrenia, and neuropsychiatric disorders. So this paper is a kind of meta-analysis of over 200 papers that involve the study of stress in humans, stress in pregnant women, neuronal development, neuroimaging, and developmental disorders. So the research question being studied here was, does maternal psychological distress affect the offspring's behavioral, cognitive, and emotional development and susceptibility to neurodevelopmental and psychiatric disorders? And some just relevance for this article. According to the DSM-5, neurodevelopmental disorders become expressed during childhood. However, other psychiatric disorders that become expressed in adolescence or adulthood are now being considered neurodevelopmental disorders. In the past decade, evidence has been accumulating that suggests prenatal environmental exposures impact early brain and behavior development in humans. This topic has not been examined thoroughly, and it's the aim of this paper to focus on new findings from human research that impact our understanding of the prenatal environment as it impacts potential neurodevelopmental disorders that can develop in the offspring. So the methods of kind of organizing this meta-analysis: maternal psychological distress was defined as general or pregnancy-specific anxiety and depressive symptoms, major life events experienced by the mother, such as illness or death in the close family, financial and relationship problems, house moves, car accidents, etc., a psychiatric diagnosis of a current or past anxiety or depression disorder, or maternal hardship due to a natural disaster and subjective distress and cognitive appraisal related to it. And this was measured with one of three methods: either self-report distress and or life events questionnaire, a physician's diagnosis based on medical chart information or on a diagnostic psychiatric instrument, or a physiological variable such as cortisol. And the results were analyzed, and so that was, they analyzed the impact or lack thereof on fetal neurodevelopment by MRI, specifically structural MRI, functional MRI, and diffusion MRI. Using these different non-invasive modalities allowed them to examine in vivo properties of the brain by using volume, surface, deformation, or regions-wise analysis, as well as characterizing the human brain across the entire lifespan. So, the question that we all want answered when we read a study with significant results is, but is the study valid? This question is particularly difficult to answer in a systematic way when faced with a meta-analysis of over 200 articles, but while all of the studies have been peer-reviewed and published in reputable journals, they all had different possibilities and constraints, as well as different modeling techniques and analysis methods. So the results, what we've all been waiting for. Maternal distress during pregnancy is associated with alterations in brain structure and function, in functional connectivity, and in intrinsic brain networks. So, given the vast array of populations that were included in these studies, as well as the variety of methods used that still produced results with similar implications, I believe that this study is generalizable to the population that I will be treating in my OBGYN practice one day. And some final results: the prospective longitudinal follow up studies that were reviewed indicate that influences are seen until at least age 29, while retrospective studies showed effect until age 40. What I take from this is that there is a need for future research to figure out the details. But in the meantime, I should and will advise my future patients to focus on their mental well being, especially during pregnancy, because it will impact their baby's brain development.